Autism spectrum disorder is a developmental disorder, and as per DSM-5, there are various core symptoms of autism. Now, these core symptoms has to be there to make a diagnosis of autism. Now, number one is deficit in communication. Deficit in communication would lead to deficit in interaction and deficit in socialization. So communication, interaction and socialization are interchangeable. Second thing is restricted repetitive patterns of behaviors in developmental period. And third one is that this impaired communication, impaired socialization is significant enough to cause impairment in social, occupational areas, in home settings, in school settings, and in classroom setting, and overall in the society. And this is not to be explained, this is not explained by any other organic illnesses. So there are core features causing significant impairment in the functionality of a child in a developmental period. Now, prevalence of autism. In the last year, we were holding a conference in Karachi, and the prevalence of autism in that conference was 1 in 56 by the CDC. Now, this year, in a span of like 1 year, the prevalence is 1 in 36. So it's behaving like an epidemic. Now, in DSM, there's 20 times increase in the prevalence of autism over the last decade. And the risk of recurrence in the sibling is 15 to 19%. Now, why this increase in the prevalence of autism? Maybe the wider public awareness of these disorders. So they are seeking health advice and they are coming to the doctors for the evaluation of their children for the early diagnosis, or there is improved detection of the ASD because of improvement in the diagnostic tools or availability of different assessment tests which are available, or because there's true increase in the incidence of autism because of the conducive gene environment interaction. Now, it's 4 times more common in males than in female, and as I have told you, the risk of recurrence is in the sibling is 15 to 19%. Genetics is always there, and in monozygotic twins, there are 37 to 90% chance of having a child of having autism in the other twin as well. Environment do play a role. It's more common in children with low birth weight, with prematurity, with birth asphyxia, with excessive use of screen medias, and conducive gene and environment interaction. Now, if you classically see a profile of a child with autism, it will be like a child you will be seeing in your practice 18 months to 20 months who will be roaming around in the room or in your clinic settings. He will not be interactive with the environment. He will not be interactive with you. If you'll be asking him his name, he'll not be telling his name. He'll be having no eye-to-eye contact. If you ask him to do a very simple task, he'll not be doing that. If you're asking him to point to some objects, he'll not be doing that. And poor imitation and pointing, and then if you are speaking a word, he'll be just imitating that word. That is what we call echolalia. And then there's gibberish language, the language which is there, but it's not understandable language. Gibberish language. That we have the videos, and we'll show it to you in that interactive workshop. Then there's the repetitive stereotypy is what we call moments which will be there. and they will be fixated with various objects like car wheels, pencils, switch on and off. Then there'll be sensory issues. I mean, with the normal, even with the normal intensities, sometimes there are hypersensitivity issues. They'll be closing their ears to the normal voice, with normal pitch voices, or there'll be hypersensitivity issues. Then there'll be poor on-seat and poor aggressive behavior as well. No how to approach a child with autism, that include detailed developmental history and history of screen media use, then physical examination, including detailed neurological and developmental examination, including developmental milestones as well. Then there will be developmental assessment using various tools, and as well as speech and language assessments, sensory sensory assessments, and occupational assessments, and behavior rating scales. The diagnosis of autism: if a child comes to you before the age of 3 years, we can use MChat. There are other screening tools as well, but this is widely used, more accepted, and more easy to apply with. So, a modified checklist for autism in toddler is widely used across the country and across in other parts of the world as well. So this is a screening tool, not a diagnostic tool. So this is good for early intervention. Now, diagnosis of autism is made on certain other tests like CARS-2. This is a second version. Another version is there, but what we use is the CARS-2 and ADOS-2. CARS-2 is a subjective test. It's simple, easy to apply, less time consuming, and it's quite sensitive, but it is subjective. So there might be variation in the person who is doing it. ADOS is basically an objective test. It's more time consuming, and less people are trained in it too. So what we generally use is the CARS-2. Then we go for the hearing evaluation in all children with autism because they present with the delayed speech. So hearing has to be evaluated before proceeding for the evaluation of the speech. Then genetic analysis is required whenever it is suspected, like a patient with Fragile X if presents to you, patient with Rett syndrome is presented with us, or patient with the Angelman syndrome. So we go for the genetic analysis. Metabolic testing is required in certain cases, like in PKUs or other things. Neuroimaging is required whenever it is required. Likewise, is the EEG. Like a patient with autism is having seizure disorder, so we'll be going for the EEG. Now, every child is not autistic. So all these symptoms like aggressiveness, not responding to the name, not command following, and fixated behaviors, they might be seen in other conditions as well. Like if a child is having hearing impairment, he may have aggressiveness in the behaviors. So he may not be having on-seat. He may not be having proper communication. So hearing impairment, likewise, is the global developmental delay and intellectual disability, and overuse of screen media, along with developmental language disorders. They comes in the differential diagnosis of autism. So every child is not autistic. Now, how to manage a child or intervene a child with autism? The primary goal of management is to minimize, because we can't cure autism. There's no definite cure of autism. So goal of management is to minimize the core features and associated deficit and maximize the functionality of the child, functional independence and quality of life. And along with that, to alleviate the family issues, family concern, because the disease is not confined to one child, it's a disease of the whole family, affecting the siblings as well, and sure, the parents. Now, this management is multidisciplinary. It involves developmental pediatrician along with psychologist, along with our speech therapist, along with developmental therapist. It's a teamwork actually, not one man show, no one person job, along with occupational therapist, sensory therapist, special need educationist, and child care worker. No, what we use, applied behavioral analysis is universally accepted standard tool, which is, there are other tools as well like Teach program, but ABA is the universally used. But this requires a lot of time per week. So what we have done in Children's Hospital over the past almost 2 decades is use of eclectic approach. We take different therapists and we take the parents, and we take parents as partner. So parent as therapist, co-therapist, along with the developmental pediatrician and allied health professional, we incorporate them. We give them the task in the hospital settings and then remain in contact with the parents, so they continue to perform these tasks in the home. And next in the when they come to you in the next for the next session, we know what is the success, we know what is the failure. So it is quite successful eclectic approach, and we have found it to be very much useful in resource constrained environment. There is no pharmacological treatment of the autism. We treat the symptom with certain drugs, and we have to use this drug very cautiously, very judiciously. Not everybody is to be given risperidone. That is what is being practiced right now. So we should discourage the use of drugs in patients with autism. Then there are certain other drugs like stimulating and non-stimulating methylphenidate, that is called Ritalin, and atomoxetine, that is non-stimulating drugs, which are used to treat the symptom, not the disorder. Now, there are certain myths regarding autism, that autism children can't feel or express emotions. That is taken as granted, but no, please, they do have the feeling. They do feel the pain. They do feel the pleasure, and they can express their emotion. May be verbal, may not be verbal, maybe in some gibberish language, maybe in some other forms, but they do have the emotions. And some people say it's because of the bad parenting, because what you see, जब आप देखते हो, autism is found more commonly in doctors community, it is more common in the army personnel, it's more common in the bureaucrats. So maybe it's because of the bad parenting, parent can't give time to their children. No, it's not true. It's not because of bad parenting. Refrigerated mom theory has been totally obsolete. It's not being used right now. And autism is a multifactorial in origin. It was used to the MMR vaccine and gluten and diet, selective diet was thought to be a causative agent in the etiology of autism, but these are just the theories, and none of these have yet been proved. So if somebody is just focusing on marketing these ideas of diet, or so we should not at least encourage them to do so, and we should not give them a certificate to promote these, because these are commercially based activities that they're doing. It has got nothing to do with the etiology of autism. Some people say autism is a childhood form of schizophrenia. No, it's not schizophrenia. It is a developmental disorder. It's a neurodevelopmental disorder, sometimes people say, and DSM-5 say it as well. But schizophrenia has got nothing to do with the autism. No, early detection and intervention is very important, because even in America, the average age of diagnosis of autism is around 3 to 4 years, where you have the community outreach program, facilities are available to you at the doorstep. But even there, the average age of diagnosis is 4 years, and this is almost, we also have the average age of diagnosis of autism around 4 years of age. So early detection of the red flags or early warning sign is very important, because when we intervene in the early period of developmental life, we can minimize the core features or minimize the feature of autism, and we may alleviate even the major symptoms, major areas of impairment in autism. So we would like to, this is the most important take-home message I would like to say, that early intervention, early diagnosis, early detection, and early intervention is much, much better. So early intervention services should be used whenever it is available, and we should have a training and quite awareness of those programs. We should go for the awareness regarding these. And watchful waiting should be discouraged. Watchful waiting, जैसे आपके पास क्लिनिक में बच्चा आता है, माँ 18 महीने के बच्चे को, 2 साल के बच्चे को माँ या बाप लेकर डॉक्टर साहब भी बोलता नहीं, अच्छा कोई और मसला तो नहीं और कोई मसला नहीं, सुनता सही नहीं, सुनता सही है, कोई और प्रॉब्लम तो नहीं प्रॉब्लम तो नहीं, झटके तो नहीं लगता नहीं, चलो बोल पड़ेगा, कोई बात नहीं, आप 3 महीने बाद आइएगा. So watchful waiting should be discouraged. We should enroll the patient in the early intervention services as much as we have. Now, red flags, there are, so for detection, early intervention and detection, there are long list of red flags, but to cut the story short, if child does not have eye contact, poor pointing, no response to name, no joint attention skill or peekaboo, lack of babbling or fixation on an unusual object or lateral gaze, or there's stereotypies, or prefers not to be touched, sensory along, that is what we call sensory issues, or doesn't play pretend games, imitate others, or to use toys in creative way, we should pick these children and get them evaluated, refer them for evaluation. This is very important. Then in summary, autism is becoming like an epidemic, and 136 is the prevalence by the CDC. Early signs should be known to the pediatricians, and early detection, timely referral, early diagnosis, and prompt intervention give better results, and watchful waiting should be discouraged. Thank you very much.